through my time with the LOCs, and also since I've joined LOCs as a commissioning lead, it's given me the skill set. It's allowed me to develop my own skills, my own resources, and it's enabled me to go for the roles and the jobs within the profession. One of the roles which I now do is chair of the local health network. So it has, as well as me helping the LOC in developing services with the LOC, it also has developed me as a person, as an individual, and has opened opportunities up for myself as well.
You know, people ask me, why do you do all that you do in the sector? Why do you do work in the local optical committee at LOC or any of these other roles? And it's actually because I and most of my colleagues who work in local optical committees up and down the country are really passionate about what they do. They're passionate about eye care, they're passionate about that being of really high quality, and they're passionate about being not just respected for what they do, but actually utilised to their maximum skill set.
It's also a bit about ownership, isn't it?
Absolutely.
You spend time becoming qualified. What you don't want to do is not utilise the full range of your skills.
And I think to add to that, I think it's also about improving the care we deliver to our patients as well. You can deliver the best care you can to one individual patient at a time, but through your work as an LOC representative or through LOCSU, it enables you to deliver that care or improve pathways for patients across large geographies and covering hundreds and thousands of patients.
And I think you're exactly right. It is about that change, and it is about being at the centre of maximising your skill set. And actually what we need for that is young optometrists who are newly qualified and got fresh new ideas to bring those fresh new ideas through to the LOCs. And that's why we do need and want newly qualified and students to be actively engaged in this programme, because we want their ideas to add to the breadth of knowledge and experience that's there.
We need to embrace change, and you're right. You know, we need to bring these ideas out, and we need to develop our services for the best needs of our patients.
And fundamentally, there is a lot of change, as you know, we've used that word a lot in this conversation, but that change will affect every element of how our sector works. So it's absolutely in everybody's interest to be engaged in that process, in driving us forward and making sure we're a really sustainable sector, to be able to continue to work for the benefit of people and our practices.
And the one thing we know, all of us, from working within the NHS is the only consistent is inconsistency and change, and we need to be able to adapt to that, which involves old thinking, new thinking, people with experience, people with little experience but new ideas. That it's the mix, and I see the LOCs and LOCs who supporting the LOCs as the engine room and the drive for that.